Assalamualaikum warahmatullahi wabarakatuh. I want to tell you about the COVID-19 virus. Coronavirus disease 2019 or COVID-19 is an infectious disease caused by SARS-CoV-2 or SARS-CoV-2, a virus closely related to the SARS virus. The disease is the cause of the 2019 until 2020 coronavirus outbreak. Those who get the disease may get a fever, dry cough, fatigue, or tiredness and shortness of breath. A sore throat, runny nose, or sneezing is less common. In very bad cases, they can even get a much worse fever, decreased white blood cells, may cough up blood, and get kidney failure. People with disease can get pneumonia and multi-organ failure if they are weak, old, and are already sick. There are people who are called asymptomatic carriers, which means that they did not experience all or some of the symptoms of the virus. This is very dangerous since they are probably unaware that they are carriers of the virus and can transfer it to other people without knowing it. How the virus causes disease. The expanding part of the lungs, pulmonary alveoli, contain two main types of functioning cells. One cell, type 1, absorbs from the air, example gas exchange. The other, type 2, produce surfactants which serve to keep the lungs fluid, clean, infection-free. COVID-19 finds a way into a surfactant-producing type 2 cell and smother it by reproducing COVID-19 virus within it. Catch type 2 cell, which perishes to the virus, can an extreme reaction in the lungs. Fluids push and that cell material pollute the lung, causing the coronavirus pulmonary disease. Prevention. There are many ways to prevent the spread of COVID-19. Washing hands for at least 20 seconds is a good way to help destroy the virus. Avoiding touching your own eyes, nose, or mouth with unwashed hand is another way to avoid catching COVID-19. People should avoid crowded places whenever possible, because close contact with large groups of people can easily spread the virus. Some people wear face masks to avoid catching the virus, and it is recommended by countries such as China, Hong Kong, and Thailand. Medicine. According to the World Health Organization, there are 55 compounds that could work as vaccines as of early April 2020. According to Anthony Fauci, director of the U.S. National Institute of Allergy and Infectious Diseases, it takes 18 months to test a vaccine to make sure it works and is safe. In April 2020, scientists from the University of Pittsburgh said they had made a vaccine, called it Pinovac, tested in mice. Another team of scientists led by Dr. Joseph Penninger of the University British Columbia invented a medicine called APN1 and tested it in engineered human tissue. meaning human cells put together in a lab to look and act like they were inside a body. The scientists learned that adding human-soluble recombinant angiotensin converting a dimer to RS2 dash tissues infected with SARS-CoV-2 made it harder for the virus to reproduce. Thank you for watching.